just trying to distract the occiput from C1. The grip onto C1. My mobilizing hand is under his occiput, and then I'm just leaning back. It's not a lot of motion. Okay, so pretty much because C1 is pretty hard to feel, right? So I just find C2, and then my stabilizing hand is going to be right above that transverse or spinous process of C2, okay? Right under the occiput. Now my mobilizing hand, you're going to use this for quite a few of your mobilizations. I just have it under the occiput, and then my shoulder is on his forehead just so I have more control, okay? And then all I do is just lean backwards, straight back. So I am giving a little bit of pressure onto C1 to stabilize, not like I'm holding it directly in place, but I am trying to provide a little bit of inferior pressure. Hands are in the same position. Now this is intervention, so just like with our extremities, you can bring them near the point of restriction and then provide the glide. Because I'm doing the mobilization and I'm trying to, now I'm going to really block C1 a little bit more because I'm going to be pushing posteriorly. I'm going to lock my wrist onto the table just for more stability, and then my driving force is going to be through my shoulder. C2, come right above it. I'm locking my wrist forearm into the table. I've got the occiput, sorry. I'm going to flex him up a little bit, and then I'm going to provide that force. I'm going to be pulling the occiput up over horseshoe grip because I want to ideally, although we know you have musculature there, is grip around to hold C1 down as I'm pulling the occiput up. So I can bring him into a little bit of extension, and then I'm just pulling upward. This is hard. This is harder to do, I would say, because you're going to feel your hand come up. Good thing that not many people have mobility deficits into extension because a lot of them hang out there. So you won't do this one probably nearly as much as you'll do the posterior glide. All right, so we have distraction, we have a posterior glide, we have an anterior glide, and then the lateral is pretty much the same as the mobility assessment. Okay, so you don't really have a stabilizing hand for the lateral glide. You're just going to use your second MCP on the occiput to glide. So find that restriction and then glide through it. Okay, I'm not side bending him. Yeah, so I'm pushing through more like lateral, yeah, like more like the mastoid. But just make sure you're not off the skull. Point of restriction, and then push. So I always think about that axis being right through his nose, and I'm just turning his head on that axis. So we're mobilizing C1 on C2, right? So picture our transverse processes. We want to block C2 and rotate C1 on C2. Block the inferior segment, you mobilize the superior segment. Okay, rotates to the left. Both vertebrae are going to want to do this, right? Okay. Now, I'm C2. So if you were going to block me with that rotation, you would want to push right here, right? Yeah. So that way I got to turn. I'm stuck, but C1 above me can continue to rotate. So that's what we're going to try and do. So I'm going to use a horseshoe grip to block C2, block C2 with my thumb. The transverse process of C2. You're going to block the side you're rotating towards to prevent it from also rotating. Okay. I go back to my spinous process. I'm going to find my transverse. Now, I want to be on the posterior side of that transverse process. I'm not trying to necessarily grip it like this. I'm trying to grip it from behind to give it that force so that when it starts to rotate, it's stopped. Okay. So I've got my finger in position. My shoulder is still on his forehead. Now, I'm going to start to rotate him. And what's going to happen is I'm going to start to feel pressure into my thumb, which is C2 trying to rotate. Once I feel that pressure, that's as far as I need to go. And then from there, this is where the glide happens. Pushing in my forehead through for that mobilization, okay? So this is me getting into position. Once I feel, you can feel that pressure in my thumb? Yep. So feels pressure into the thumb. So that's I don't need to go past that because then I'm just getting lower cervical rotation. And then I'm just using my forehead to do the glide. And that's what I would hold.
Straight down. Down and lateral?
Yeah, down and a little lateral. So I did this. I was blocking the transverse process of C2 with my thumb. That can, that's what it looks like. That can be a little testy, especially if you're going to hold it for like 30 seconds, right? That does actually bother this thumb of mine. So what you could also do is hook your MCP onto that posterior aspect of C2. Now that's a little bit harder for me to stabilize. find the spinous process and you just do a gentle oscillation, okay? And that's mostly what you're gonna do. I wouldn't, like, you're not gonna use this as a, like, mobilization for extension. That's what we're gonna use our up and down glides for, right? So these are gonna be oscillations. So I've just got my thumbs, one right on top of the other, and I'm just doing really gentle central pressure, just like that. Okay, and you can just kind of work your way down. I could use this and flex his head a little bit if I want to get a little bit more on this kind of mid-cervical spine. And a unilateral PA, find your spinous process, move over to the transverse process, still have the thumb on thumb, and then just do a little bit of a lateral pressure. What's happening? So we know if the facets are actually moving, we're getting more of this motion, right? Up glides or down glides. Okay, just from their facet orientation. So if we're just cramming them together, we're getting some compression distraction. And if that facet is irritated, that could be a provocation test, right? Because that could be irritating to that space. That's not going to really tell us the mobility because we're not getting that gliding. But if we're trying to do some OSR for that facet joint, this may be appropriate if it's not painful. Want to get under the occiput and just shift your weight backwards. So general traction throughout all the vertebrae usually feels really nice for muscle guarding, pain. You could turn it into an oscillation. You're going to stabilize below, horseshoe grip to mobilize above. Find my C2 landmark, C3, C4. So I just walked my way down the spinous processes. My hands are really close together. Still going to lock my forearm down of my stabilizing arm and then just lean backwards. We're just like this. If this was the orientation and we did our general distraction, we would get true facet distraction, right? But we know our facets are not oriented in that position, right? They're more like this, okay? So in order to get true facet distraction, we want to do a superior posterior force. We're gonna kind of drop down. My knees are dropping down a little bit, okay? You can still do that segmentally. When would you want to be that specific to a facet? Arthropathy. There's a meniscoid entrapment. Yeah. Okay. So they're going to be the same. Still two horseshoes. You're just going to drop down and back. And that's it. It's still a small motion, right? But I'm just dropping down and back. Unilateral up glides and down glides. Now with these, you're not going to necessarily have a stabilizing hand. You're going to have one hand that supports the head, and you're going to have one hand that's providing the force. Let's pick a segment here. So I found C2. Let's work my way down to C3, 4. So I want to make sure that I'm at the segment, so that might take a little bit of just feeling like where I feel that up glide and down glide happen. So I'm going to come out of it a little bit. I'm going to find that articular pillar, and then that's where I can either sit here and do oscillations, support it on my stomach, and then I'm using my other hand to support his occiput because I want him to relax as much as possible, so I can either do oscillation or I can just do a hold. So my force is medial and posterior. If I want to do an up glide, I'm going to assess it first. So I'm going to start to do my up glide assessment, working my way down. I'm side bending him to the left because I'm looking for an up glide on the right. Okay, say I find that segment. This is going to be a medial and anterior force as I move him into an up glide. So I can just do like this, or I can pull and hold. This is the facet joint that we're talking about. Down glide, up glide.
And are you keeping their head in neutral?
So I brought them into side bending to try to get to that point of restriction.
Okay.
Yeah. Talk you through mine. So I'm going to start paraspinals and work my way up to the suboccipitals. I'm giving a lot of pressure. Suboccipitals, dig in there a little bit. It might not be that comfortable. So if you find C2, go above it and lateral. And right in that space is where that triangle is, right? Right under the occiput, between the occiput and C2. Feel both sides. You can go out, work your way out to this transverse processes of C1 while you're there. All right, work your way now forward, go to the SCMs on both sides, okay? Move laterally, feel the scalenes. So I'm just kind of strumming along the scalene. Is that tender? Is it different side to side? I'm gonna work my way posteriorly so I can feel the upper trap. And then once you come more medial, go for that levator. Okay, perfect. So do we find some impairments that we might want to treat? Okay. So hold, relax. I think I use this one for the suboccipitals. What I'll do, I'm supporting your head. I'm gonna bring her into just a little bit of rotation, and then I'm gonna say, I want you to hold right here, don't let me move you. So she's gonna hold here, I'm gonna provide a force trying to rotate her to neutral. So she's rotating to the right. So she's gonna hold and then completely relax, all right? So hold right here, don't let me move you. I'm providing a little bit of force this way with my right hand. And completely relax, let it go, good. Hold, don't let me move you. So, yeah. So I'm not really having her turn right, so then I can grade the pressure. And then you wanna make sure they're fully relaxing. So their head should be really heavy between each one. That's important, right? It can be like 3 to 5 seconds. You can do the same thing on the other side. I find that one's really effective for the suboccipitals. So you could, so technically, if you would do the same thing to the other side, so say I had her in neutral, but now my force is coming this way, into left, I'm resisting her into left rotation, that could be reciprocal inhibition for the right rotators. Suboccipital release, this is usually a popular one, although I would caution you, if someone has a lot of guarding, this can be really uncomfortable. So I think when I was first a student, I was like, oh, this one's great. I love it on me, like from studying. But when I would go to try it on patients, it would be like too much. I was just reading their response. So just be careful with it. So all you're gonna do, cup your hands like this. You want your fingertips in those suboccipital muscles. Their occiput is in your palms. And then just lean backwards a little bit, but let your fingers kind of dig into those suboccipitals. Press into the suboccipitals, and then I'm just providing a little distraction. Especially like your patients with headaches, if it's really irritable, it might be too much. So you're given like a little distraction. SCM, strain, counter strain. So what's the action of the strain of the SCM? Same side, contralateral rotation, right? So if we want to shorten that muscle, if I want to shorten her right side, I want to bring her into left rotation, right? Because if it would contract, that's what would happen. A little bit of flexion, bit of right side bend. But in the way you know is I'm palpating the muscle, right? So if they had a trigger point there, I should feel that muscle become a little bit more limp. Now you want a lot of body contact with strain, counter strain, right? Because if they're not able to relax, and sometimes people have a hard time in the cervical region, then it's not going to be effective. Right? So remember, I'm palpating, but I'm not pressing. And then you hold for 30 seconds. And then you slowly move them out of that position, and then reassess, palpate it again. Straight counter strain, sure. Okay, so step 1, palpate the turgor, the area that has increased turgor. Step 2, passively shorten that muscle. Palpate that turgor point until you feel it's relaxed, and the patient says, yes, that feels a lot better. And then you can keep your hand in that position, but you're not gonna press anymore, but just as like a placeholder, keep your hand in that position. Hold for 1.5 minutes. Slowly bring them back to neutral, and then reassess that same place that you've been holding your hand to see if that turgor point has released. Use the heel of your hand to apply some pressure, and you can just knead like that. If you want to do passive, you're going to provide pressure and then just use your body to side bend them away, and then bring them back to neutral. You're going to lengthen the muscle, so by side bending away. This is really important that you have the head on your stomach, Goran, so that you can rotate. So that way you've got full control of the head, right? So that when you're moving them, they're able to relax. So I'm just moving my body here. I'm not actually like moving my arms. And then if you were gonna do active, you would give the pressure and say, okay, I want you to bring your head, you could say back to neutral or over to your right or left shoulder, whatever's appropriate. So bring your head over. You're still supporting them, and then they relax, right? And you take them back out. Provide the pressure. They're gonna contract that muscle by moving the head, and then relax. The upglide soft tissue flow. So if I'm gonna do the right side again, I'm gonna support the occiput with my left hand. The right side, I'm gonna start with my palm directly underneath her cervical spine. Glide direction of force, but grab a little bit of the soft tissue as you do it. So you're not doing a true upglide, you're just getting a little bit of upglide, but you're also getting some muscle pump to the paraspinals. It's more my body. So that way she's locked into my stomach, and I'm just turning with my body. So you could do it for guarding of the paraspinals. You could do it. You get a little bit of scaling in there if they've got some hypomobility and you're just trying, because a lot of times guarding will come with hypomobility. So if you got a combination of the two and you just want to do like some kind of an oscillatory technique, it could work for that too. Shorten it, right? Shorten it. All right. So I can do that in 2 ways. Right, I can bring him into a little bit of side bending, and I can bring the shoulder up. So I'll try to do both. So you can use the head of the table, but I'm still holding my trigger point. That's important, right? Because that's how I'm going to determine if I've made any change. But I've taken my pressure off, what I feel under my fingers. So does the muscle relax? Okay, so, and then what do I do? Now that I have it in a nice relaxed position, I don't have any pressure on the muscle. Now what do I do? Hang out for 1.5 minutes.